Welcome to Inner Source Therapy, where we discuss mental health topics. My name is Christy Escobar, and these are my colleagues.
I'm Deborah Ashway Moorfield.
Hi, Sherry Greenwald.
Hi, I'm Lisa Barrow.
Today we're going to be discussing a very common issue amongst Americans, depression. With the holidays in full effect and with everyday stress, depression seems to come up a lot. People sometimes don't recognize what it looks like, what it feels like in themselves and in others. So today we're going to go over some different pieces of depression, like what it is, its causes, signs and symptoms, who's at risk for it, and how to treat it. And so I think we'll just take it from there. What is depression? And
what does it look like in our clients, and what are some of the common symptoms that we see?
I see a lot of sadness, a lot of being really hard. My clients are really hard on themselves. They get into a negative thought pattern that's difficult for them to get out of, and then they get low energy and what I call beating up on yourself, where they can't seem to do anything right. And then it's difficult to get out of bed, it's difficult to enjoy the normal activities that you used to enjoy. So then they start to isolate and not want to go out.
I think with kids, teens, tweens even, and even younger, sometimes depression can be hard to identify because some of it can look like teen angst, or sometimes parents will say to me, I don't know why they're acting that way. They might be extra clingy. They may have an unusual concern that something's going to happen to one of the parents, not want to go to school or be irritable. So that's why if that type of behavior goes on for an extended period of time, like more than a week or two, it's probably important to get a good professional evaluation, because one of the things about treating depression is making sure that you treat it as early as possible. It's important to listen to teens who may have suicidal talk. For example, a teen who says you won't have to worry about that much longer, or maybe you would just be better off without me, or comments like that are really important to take seriously, to address, and to seek a professional consultation around.
And sometimes I know we get clients that are referred to us from the pediatrician. The pediatrician sees something concerning and refers to a therapist for more information. And I think for adults as well as children, it's important to follow through with that. I think there's also a stigma out there of mental health. Oh, depression, it's just, they had a tough time, their best friend just moved away, or things like that, and they kind of think they'll just get over it. But if a professional like a pediatrician is suggesting, why don't you take them to a therapist, I think it's important to follow through with that.
And there's different, there's a wide range, right, of different kinds of depression. It can manifest in different ways. Like you were saying, there's major depression.
Yeah, major depression. I think there's episodes of where people have these severe episodes of depression, and they're not, and it's having an impact on your life when you're not able to go to work like you're supposed to, you're not attending to your family like you used to, you're not doing the things that you usually love to do. And that's when it's time to maybe talk to somebody.
Whenever it's affecting one of the major life domains in any way, whether it's family issues or legal issues or financial issues, mostly it can be debilitating, and it can interfere in almost any domain.
One of the things we've discussed is the sadness and wanting to stay in bed. There's also another type of depression that we see, and it's not only in children and adolescents, but that is the more anxious, angry type of depression. where it'll be a depressive anxiety episode where the person worries a lot about the future and has a lot of sadness over the past and may be unhappy with where they are in their life circumstances, and that creates a lot of anger or frustration. And acting out for children. If you see your adolescent doing things that, well, that's a little unusual for them, or even in an adult, sudden onset of anger that they hadn't had previously, that's something to look at too.
And it does, depression presents different in different people, different in women, different in men, children, adolescents.
I think women are probably more prone to depression. Men, I think, probably present differently when they're depressed. Sometimes you'll see an increase in substance misuse, or men may respond with anger more often than sadness. There's also a tendency for people who have PTSD to be prone to depression. So there are certain conditions that can make you more likely to be prone to depression. PTSD is one of them. There are also unique circumstances that would cause a person to become depressed, such as, believe it or not, having a baby. Postpartum depression is fairly common in women.
Also, what are some of the treatments that are commonly used for depression? We talk about therapy, but there's a lot of different types of therapy that are utilized.
One of the things I like to think about is mindfulness and EMDR. And the reason that I like those particular therapies for depression is because of what I mentioned in the beginning, was the constant berating of the self, which is, I shouldn't feel this way, I have a brand new baby, I should be happy. I shouldn't feel this way, I have everything I need. I shouldn't feel, it's all these I shouldn'ts and blaming of the self, and I should just be pulling my socks up higher and get over this. And well, you have to ask yourself, well, if you had a broken leg, would you just expect yourself to get over it? And so mindfulness is I am sad, I am frustrated, and it's accepting the feeling and doing a body scan and then saying, and breathing with that and saying, what information is that feeling giving me? And then what do I need to do about it? Do I need, for anger and high anxiety type of depression, then I need to calm my system down, and for more of the sadness, low energy depression, I'm going to need to do a type of exercise to get my energy back up. And what have you all found to be effective?
The same thing, that mindfulness, that seems to be the most effective, and I don't know if that kind of helps take us out of our worry mind, whether it's about the past or the future, and it kind of brings us into that wise mind where we're concentrating on all five senses, and so we're not focused on past worries and we're not focused on future worries.
A lot of times families will ask me, how can I support my family member who has depression? And it's one thing that Sherry mentioned, I'm afraid is all too common, and that is folks who are uninformed might say, oh, come on, why don't you just get up? And it's just not that easy. So providing support can look like just talking with that person, listening to what they have to say without judgment, sort of listening from a place of not knowing, not making assumptions about what they can or can't do, and then, offering them an opportunity to get outside, to take a walk, but not to pressure that person or to push that person to do that. One of the things family members say, or people have said that have experienced depression, that was the most helpful for them is when a family member or a friend was willing just to drive them to a doctor's appointment, to make sure that they get there, to offer some support while they're there. So even though these things seem small, they're actually very important to people who may be depressed. For the person who is depressed, being able to look at tasks, folks can get really overwhelmed by tasks, so learning to break really big tasks down into a really small task. For example, one gentleman shared with me that what worked for him was to set his alarm for 10 minutes and do as much housework as he could do for 10 minutes every day. And that would sometimes motivate him to keep going. So just breaking those big tasks down into small tasks are ways that individuals can deal with their depression.
Yeah, just doing what's right in front of you.
Mm-hmm.
Sometimes that helps instead of what you're saying, they taking it all on at once. Some people say, what do I do? You know, some things can trigger depression, like losing a job or getting divorced, or even good things can trigger that because there's a sense of being overwhelmed.
Yes.
So just doing what's right in front of you and focusing on that, which kind of goes back to that mindfulness, I guess.
Oh, it does.
Right.
And not blaming yourself or trying to fight it
Mhm.
and saying there's something really wrong with me, but I am okay, and what do I need right now for myself? What do I need to do?
Clinically speaking, there are a few things that can create depression in people. One of those is the type of depression that you see with bipolar disorder. Another might be a person who has had a psychiatric struggle and may develop a psychosis, and there can be some co-occurring depression. So depression can be everything from seasonal affective disorder, you're not getting enough sunshine and vitamin D, all the way up to maybe you've got some significant psychiatric struggles. And so getting a good evaluation is critical in terms of determining what your course of treatment should be. And I think that there are a number of therapists in the area that can offer that type of evaluation, and if they can't treat you, for example, sometimes therapists can't prescribe medication, they can refer you to a psychiatrist who can make that determination.
And one more thing I think people might be interested in hearing is, like I said at the beginning, it's the holidays. The stress, it's overwhelming. People tend to find themselves depressed, even though it's supposed to be a happy time of the year, they find themselves depressed. How would a person during the holidays help themselves feel different or work towards feeling less depressed? What are some things that they could do?
I can say that volunteering is one way. Kind of getting out of the house and getting outside of yourself can sometimes be a way if you want to do something for someone else. Many people this time of year who have lost a loved one are experiencing grief as it's related to one mother. I know this is her first holiday without her child. So in those instances, being able to offer some support to someone else can be a good way to make it bearable.
Yeah.
And maybe
lean on someone. Look, ask for some help. Ask, tell your friend, call a friend up or mom or whoever, and talk to them. And I think another thing is keeping your expectations low. I think when we go into the holidays, it was all like we're going to have a huge tree and we're going to get all the best gifts and we're going to cook the best meals, and it doesn't go that way.
Well said.
And so you overwhelm yourself, and then when it doesn't work out the way you wanted it to, you're upset.
There's a lot of expectations around the holidays, and it just seems to get larger and larger each year. You know, everybody wants more and more, bigger tree, more presents, and we're getting further and further away from what what it's really all about, which is none of this stuff. But I think that stuff puts a lot of pressure on people.
I think so too, and then I think the overwhelmed, and I think I'll just put the covers over my head until this is over. And So I think it's going back to some of the things that we originally talked about, is just one thing at a time. What's one thing that I can do that I would really enjoy doing for someone? Is it volunteering? Is it taking a walk? Is it just getting out in the sunshine and sitting on a bench, and maybe looking at the decorations? And is this grief and loss? So that, do I go and visit the gravesite? Do I have a memorial or a special meal for the person that I'm grieving for? But keeping it more simple, simplifying, as opposed to thinking I have to do it grandiose. It's what would make you happy, not everyone else happy. Again, it's the shoulds and oughts that get us into trouble, instead of I am, and this is what I can do.
Christy, I'd like to add just one thing about depression, and that is sometimes your first step, if you are experiencing some symptoms of depression, should be a good physical examination. There are some conditions such as thyroid disorder, heart disease, and a few others that can actually cause a person to feel depressed. So sometimes it's important to have a good physical and make sure you don't have any of those things going on that need repaired before you move into getting an evaluation from a therapist. Of course, that isn't true if the person is presenting in crisis or talking in some of those ways, some of that suicide talk I mentioned earlier. But it's amazing how your body can affect your mind, and how your mind can affect your body. And likewise, lots of times people who have depression will have what's called a somatic symptom. They might hurt. Depression literally can physically hurt. Headaches, body aches, those kinds of things. So it's important, as we always like to say, to treat the whole person, right?
Absolutely.
And as far as, I guess, self-medicating depression through substance use, like you were talking about, that really does have an adverse effect, and it can kind of spiral out of control because you get whatever substance you use, whatever you're using it doesn't even have to be a substance. Some people use, shopping or gambling or anything that they are trying to calm themselves down with or to elevate their mood with will be a momentary fulfillment. And then, and so that'll bring them up to here. Like, here's the line of normal. So they'll bring themselves up to here. But then when that wears off, they drop even below where they were before. So then the next attempt is going to be, say they are using alcohol, they're going to drink again. They won't quite come up that high again, but they will fall even further. So here's the line of normal, and they're kind of going like this. So it does have a spiral effect that just gets exponentially worse.
Carbohydrates can do that in the case of overeating, and sugar. Some people will take that sugar fix.
That's a really important point, and especially when you talk about diet and exercise. I think that sometimes there are some simple things that we can do every day to feel better. I know a man who finally, after a long time in therapy, said, I'm going to eat an apple a day. And I thought that was huge, because this is someone who smoked a lot of cigarettes, drank a lot of alcohol, and did some things that weren't so good for his body. So when he was able to say, this is my commitment, I'm going to eat an apple a day, that's a great start. Everybody starts somewhere, and eating a nutritious meal, lowering carbohydrates, a little higher in protein, especially on a consistent basis, can make a big difference in how well we're feeling. So just in general, that whole body wellness that we're talking about again, avoiding those things that can cause us to sort of cycle up and down in our moods, and staying with foods and things that will help us be more balanced and even.
Okay, well, I think that's it for today. I just want to thank all my colleagues for joining us today to talk about depression, and I hope you have a happy holidays.